People, when I think of preventative care for things like that,
Yeah.
you usually get referred to the ENT. I was just referred to the ENT.
Okay.
I had the
Hmm.
scope
Okay. Okay.
multiple times. Acid reflux. We could
Okay.
talk about
Got
that.
you. Got
But
you.
I'm wondering what are some symptoms that are missed of things like throat cancer,
Hmm. Yeah.
and how do people keep an eye on that?
Right. So symptoms of throat cancer can be a sore throat that doesn't go away. You know, sore throats are very common. Viruses, common viruses that are out there, strep throat, etc., that you can which is a bacterial infection that can cause sore throats. So they're common. Other reasons too, just like your acid reflux, right? Acid reflux can also cause ongoing sore throats. But if you have an ongoing sore throat that's not going away and there's no reason for it, if you are having difficulty swallowing, because if there is a tumor or a growth that's developing in the back of your throat, when you go to swallow, it can interfere with your ability to swallow. You might even notice a change in your voice, even though it's a tumor in the back of your throat. It may result in a change in voice. You might be spitting out and see some blood mixed in your spit because of that tumor. You might notice a lump or bump. I get a lot of patients who come in who really don't have any throat symptoms, but they notice this growth on their neck. They notice this lump here on their neck that won't go away. That may be a sign of an oropharyngeal or throat cancer. And then another symptom, which a lot of people would not even know about or think about, is unilateral or one-sided ear pain. That is a big red flag, right? I've had patients who went to their primary care doctor because they had an earache and their doctor said, "Oh, you have an ear infection. Treat them with antibiotics for months and months and months." It's not an ear infection, it's actually a tumor in the back of their throat that presses on the nerves in the throat that give you sensation, and it's causing what we call a referred ear pain. So unilateral ear pain, not in the face of a real ear infection, really raises the red flag. You better put that scope down and look in the throat or get a good examination of the throat to see if there's a tumor or mass.
What can doctors do across fields to make sure that people get those referrals faster?
Education is the biggest thing. Like I said, the primary care, and this is not a bash on primary care whatsoever, because that's not their field of specialty, right? But educating primary care physicians on these are some of the signs that you need to look for. Things that, like that unilateral ear pain, they might not have known that. Like, really? That's a sign of a head and neck cancer? We know it as ear, nose, and throat specialists, but education is key, not just to other professionals or my colleagues, but just to the general population and layperson in and of itself. That's why I'm on social media a lot, is education, 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 to help, because the sooner you can make the diagnosis, the quicker you can treat the
Mhm.
condition.